This is something that CRARR has been pushing for a while, isn't it?
Yes, actually since April 2020. At first, Dr. Arruda had said that, yes, they would collect this race-based data, and then went back on his word because essentially they said that it was too sensitive to collect.
Okay.
So yeah, that's part of the reason why we're still pushing it today.
What is your opinion on the government kind of making this statement and then going back on it?
Well, first of all, the government of Quebec doesn't acknowledge that systemic racism exists, and that's part of the problem. Because I think that they know that if we start collecting this data, it will show the truth that there are systemic disparities. So I think that's part of the problem. And, race-based data is actually something that's not new. The US is already doing it, the UK as well. So I think we're really behind. So we need to get on board with this. So that's what we're working on right now. And we're trying to push Quebec to collect this data, and also the federal government, because it's a shared jurisdiction between both.
What are sort of the tactics that you guys are using to push for this data to be collected?
So in collaboration with Marvin Rotrand, the city councillor, we wrote a motion trying to push federal and provincial public health authorities to collect race-based data on COVID-19. That's the first part we did. And then actually right now, we're actually still putting pressure on the Quebec government. And we're taking this initiative also with the federal government at the moment. So we're continuing, basically trying to keep active, keep this in the media, because the more we make noise, the more likely they're going to start listening to us.
On February 23rd, 2021, Montreal City Council adopted a motion calling on the municipal government to urge provincial and federal public health authorities to collect COVID-19 database on race and socioeconomic factors. In Quebec, the collection of such data has been resisted due to the unwillingness of political leaders, including Premier François Legault, to recognize systemic racism in the province. Considering the challenges of systemic inequalities your borough is facing and the need for a coordinated approach to collect race-based and socioeconomic data on COVID-19 and other issues, how do you intend to ensure that such data is collected? So thank you very much, Ms. Nicasio. I have a regular call actually about COVID with the municipal minister, Rouleau, with other mayors and elected officials, and we could raise it there. But I think Mr. Rotrand also mentioned earlier that, if the public makes noise with their MNAs, their provincial representatives, that also helps to get these things moving. I think it's absolutely a necessity that we have this kind of data, and we need to push the government to do so. Mr. Rotrand, did you have something?
I'd like to make a suggestion. I think we can all agree on, all six of us. I think we need to mandate our clerk, Maitre Reeves, to write to our local CUS indicating that we've received quite a few questions at the Borough Council asking for race-based and socioeconomic data in COVID reporting, and asking them to raise it with the instances of the Department of Santé Publique here in Montreal and Quebec City. So it goes up the chain from us. I think it's our responsibility as a borough when we get it's obviously a concern of community groups and citizens within our borough to pass that on to the relevant authority. It's not our jurisdiction, health, it's not our jurisdiction to report, but however, the question is a very valid question. All the questions we've had tonight on this subject have been important. So my proposal, my suggestion is that Maitre Reeves be mandated on our behalf to indicate to the CUS that our citizens are asking for this type of data and asking them to raise it with their relevant instances at Department of Santé Publique, Quebec and Montreal.
Catherine Nicasio and I worked on the motion with Marvin.
How long did it take the both of you to research this and put together the motion?
Well, I was doing the research for a little while, for 2-3 weeks. And actually all the reports that I was seeing on COVID-19, all of them, first recommendations was race-based data collection. So that's what we brought up with FO. And Marvin was already fighting for this also with CRARR back in April 2020. He was trying to get this rolling back in April. So we communicated with him, and he said, okay, let's go forward with this. Let's write a motion trying to push for this again. And we were on a short deadline, but we made it. So
What was your reaction to what she had said?
well, it's nothing new, I guess. I guess what Marvin Rotrin said, trying to get this to go up the chain of command and write, a formal letter to Quebec public health authorities. That's what we're looking at doing right now. And I mean, I know that she's in contact about COVID with the provincial public health authorities, and she will bring it up, she said, at the next phone call that they do have. So yeah, as long as we keep putting pressure, we keep this, this going, we keep asking our representatives to pressure the government, I think that eventually we're going to get there. And especially since the new Stats Canada report came out actually on Wednesday, basically confirming that racially diverse areas have higher numbers of COVID-19 mortality. And that's just even more information coming out supporting the need for race-based data. So it's a matter of time at this point. We really need to get on board with this, yeah.
Why do you think that racially diverse communities are being disproportionately affected by COVID?
On one hand, I think that there are health inequities to begin with, even regardless of the pandemic. So if we don't address the root causes of systemic disparities, then I mean, whenever there's a pandemic or whenever there's another crisis, people of color are always going to be the ones the most affected. So at the root of it, we need to find solutions. Well, first of all, we need the numbers, we need the data, and then be able to research, analyze, and be able to find solutions, policies that target racial disparities. So that's the first part. And the second part, in order to have better measures, like I said, we do need that data. I guess at this point, it's just catching up.
Have you noticed that in racially diverse communities, maybe in particular in Montreal, that maybe there's more people who are frontline workers, such as like nurses?
Oh, yeah, exactly. I mean, a lot of them work in CHSLD. A lot of them work front lines. A lot of them work different jobs, that because they need to be able to afford things. So that's also a problem. They're also in jobs that maybe don't protect them as much, that don't have the protective equipment. They take the metro. So there's different aspects to this. There's different factors. So people who are more, socioeconomically, if they're struggling, then that makes them more vulnerable as well. So there's a relation with that also.
Okay, thank you for explaining that. And I guess, when hopefully we do get to the point when the provincial and federal government is collecting race-based data, and, they're noticing, we're finally having statistics that, these communities are disproportionately affected. How would you maybe like to see them provide help to these communities?
Well, I think the first thing is to be able to make that data available, because essentially the data that is collected, it's very hard to access most of the time. So that's one part of the solution. And then to be able to reach out to these communities, I mean, even get some relations going with them, trying to ask them what they need, and at the same time, addressing systemic disparities with policies, with measures, concrete changes. And that all begins with firstly admitting and acknowledging the problem, which is, systemic racism.
Okay. Would you also maybe like to see more testing centers if maybe there's not enough in these communities?
For sure. And also for vaccination, the report came out saying that racialized communities should be, the next people to be able to get the vaccine because they're more impacted. So again, to have vaccinations more available, more centers that will provide that, and also, yeah, like you said, more clinics and more access to health.
Is there anything that I didn't ask that you think is important for me to know?
Well, I know that a lot of people are afraid that this data, if collected, will be used in the wrong ways. And there are ethical guidelines and protocols that protect privacy and human rights. So that's not even like in the question. I mean, it's not going to happen. This data will be used by professionals, researchers, to be able to come up, like I said, with more effective policies to address systemic disparities in our healthcare system. So yeah, that's just something I wanted to mention, because I think it is a fear for racialized people in general. They're also, I mean, they don't trust our healthcare system, which I wouldn't if I was them either, you know, considering what they're going through. So yeah, that's something I wanted to put out there.
Thank you. Thank you for sharing. And I guess I just want to ask from that, when we try to visualize this data collection, is it solely, you know, when these people are getting tested and it's being recorded? Is that how that data is being collected?
There are different ways to go about it, and I think it's also a voluntary basis, I believe. So yeah, there's different ways to go about it. I'm not sure how they will decide to do it exactly. I don't think I can comment on that, but there are ways, effective ways, but mostly on the voluntary basis, I think, and just you know, recording and asking the right questions to the right people.
Within your, you know, demand for this data to be collected, would you like it to be anonymous?
I think it will be anonymous. Yeah, I
Okay.
believe in my. I'm not sure about that actually. I don't want to comment on just in case it's not right. But it's protected information. That's what I know. So nobody will know who the people that are being recorded are. Yeah, the privacy of people will be protected. So I guess it's not anonymous to the people who will be looking at the data. But at the end of the day, their privacy and their human rights will be protected.
Okay, great. Yeah, no, sorry, I'm asking a lot of questions that are kind of
No,
like
it's okay.
hypothetical.
Yeah. It's good. They're good questions, because at the end of the day, I mean, that's going to be the next step to figure out, okay, so, you know, we want to do this, how we're going to do it the most, you know, effectively.
Okay, thank you. Thank you so much. And I know, you know, there's no statistics, but does CRARR maybe have like any kind of estimates or some type of numbers as to, you know, how much more these communities are being affected?
I do know with the report that Stats Canada came out with, that actually it confirms that racially diverse areas, people of color are like twice as likely of dying, or have died twice as much from COVID-19. But again, we have some information, but not enough. So I can't really speak on stats. There are a couple of reports out there, but that's why we need race-based data, and we need these numbers to be able to identify, because if we don't get the numbers, then a lot of people are left invisible, right? So that's the reason why we're pushing for this. But the report that came out Wednesday does say that people in those communities are twice as likely to die than I guess people in wider communities.
Are you hopeful that this will happen?
Yes, more and more, I guess, because now, especially with all the information, the new information that's coming out, the new data that's coming out, it's very hard to ignore at this point. And like I said, the US is already doing this. They have been doing this. They have a task force on this. So we're really behind at this point. It's like it needs to happen, and it's a matter of time. And I do believe that the Quebec government will make the right decision. I know that at first they you know, tracked back and said they weren't going to do it, but given what we know now, I believe that this is their chance to actually go forward with this and do the right thing.